It's another educative Saturday on the farm, and today I want to address an issue that came up to me last week when I was doing my video. And in my last week's video, I was talking about fowl pox and its management or vaccination processes in chicken. Some of my fans came to me and said that they needed it to be an illustrative session so that they can be able to identify what fowl pox looks like and how it should be managed in their birds. So today I have a sample of a bird that is currently undergoing a fowl pox viral infection. The bird is not a chicken though, it's a turkey poult. What's funny is across all these birds that are domesticated, you find that the viruses that affect them cut across the breeds. So when it comes to turkey, people may assume that turkeys normally have lesser or have a higher resistance to diseases, but the truth is they are more susceptible to diseases as compared to chicken. So in my hand here is a turkey poult that is about 1 month old, 1 to 1.5 months old, and it's currently undergoing a fowl pox infection. As you can see, if I move the bird closer to you, the swellings that are on the face are what are characterized as fowl pox infection, and that is how fowl pox manifests itself in turkey poults and as well as chicken. So the funny thing is, when birds are infected with fowl pox, normally it does not affect their feeding or their living. The challenge comes when the swellings have become so big, like in the case of this turkey poult, such that it starts blocking their vision, as you can see in the video. Both of the eyes get to be shut. And then in most cases, because this turkey is experiencing such infection around the eye and nose areas, it results in another infection as well, which is the infectious coryza. Currently, this one has not yet been infected by infectious coryza, which is more of a bacterial infection, but the vets online can actually correct me if I find it wrong, but I think I'm right. The infectious coryza normally manifests itself within the eyes, and you can always see some whitish substance forming in the eyes of the birds, and it goes on to actually also shut their eyelids. But with fowl pox, it looks like I have shown you in this bird. The swellings get bigger and bigger, they get to shut off their eyes, and in the long run affect their breathing and vision. At the point that their breathing and vision is affected, then now the bird is at danger, because now it is not able to see, and if it's not able to see, it's not able to feed well. The recovery process normally requires the birds to be able to feed quite well actually. And in most cases when you are treating sick birds, I always advise my farmers and my clients that you need to feed your birds on chick mash. The chick mash is always a very nutritious meal. No matter the age of the bird, let it be an adult bird, let it be a young bird or within the middle stages, it is important that when the bird is sick, you feed it on highly nutritious feed so that it can help it recover faster. And that always comes very available in chick mash. So as you can see this bird here, it has been affected by fowl pox, and mostly I cannot talk about it being treated because it's a viral disease. That means it should have been vaccinated against the fowl pox virus itself. The management process is rather easy. Normally when it comes to chicken, when they are at about 5 to 6 weeks old, they are always administered a fowl pox vaccination. The fowl pox vaccination is always done using a wing stab. Wing stabs are always done on the wings of the bird. The wings does not mean that you inject the muscle with the viral substance, but no, the vaccine is injected on the skin that lies right here. The agrovets and the shops that sell these vaccines normally have the needles that are used for administering this vaccination. The injection is normally a through and through injection, but you need to be careful not to inject the veins that are visible on the bird. As you can see, if I stretch this bird's wing, you can actually see around here there are some veins. Hopefully you can be able to identify the venous areas. So you should avoid the veins that are on this skin of the wing when you're doing the vaccination. And you need to have the vaccination needle. It's normally a two teeth, or it has two pointed bits on the needle. So you put it in the vial of the vaccine and inject through the skin. The vaccine is normally oily, so once you inject through and through, it will always be able to be remaining on the skin or inside the skin of the bird. By doing that, you shall have avoided such a challenge. But in the case that you missed your vaccination and your bird is now affected by fowlpox vaccine, I am not a vet and I have to put that right out there. But I always find that one, you need to first separate the sick birds from the healthy one. And by identifying the sick birds, you look for the symptoms, which are the swellings that I showed you on this bird. This is what will be able to show you what fowlpox looks like on your chicks and your turkey poults. After identifying what fowlpox looks like on your chicks and your turkey poults, you separate the sick one from the healthy ones. Two, normally you need to reduce the risks of further spread of such a disease. The main way is to find a way that, normally when the birds have such infections on them, you find that the other chicks tend to poke on the areas that are swelling on the bird, and this increases the chances of transferability. So in order to avoid this, normally you are advised to apply an antibiotic ointment that are provided by the agrovets that are around you. You can reach out to them and they'll advise you on which one is best. You will apply it on the areas of the bird affected, on the patches that are swollen. This will limit the other birds from getting interaction with the infected areas when they are poking themselves within their brooder. The third option for managing this is that, one, you need to subject your chicks or your birds to a wide or broad spectrum antibiotic. The reason why you'd use a broad spectrum antibiotic is that once the viral load on these birds has gone high, there are chances that their resistance to diseases will greatly be reduced. So they are also susceptible to other infections that may come to them. Two, there is no direct treatment that comes for fowlpox. Therefore, a broad spectrum antibiotic would help the bird to overcome the disease by simply improving their immunity and boosting their chances of fighting the diseases. So this is what is going to help you. Vaccinate your birds when the right time comes, and we normally have our vaccination schedules as we are giving out the birds to the clients that have bought from us. Two, we always help our clients to be able to vaccinate their birds, and that means that we offer the training for the farmers through our vets and our veterinary offices. We offer them the training on how to vaccinate their birds against fowlpox. The third option is that you need to be able to call a vet to your farm anytime there is such a necessity. The reason why this is because, one, the vets are professionally trained, and two, they'll be able to give you the best advice compared to what is learned online. But another challenge always comes when you get to experience that some of these vets, besides having learned this in schools, are not practicing the actual practice of rearing the birds. So in such cases, there are instances where other farmers' experiences may prove to be helpful compared to actually just leaning in on sometimes not so readily available vets. And for some farmers, being that poultry farming is normally considered as a way of people to outcome poverty, you may find that it's a challenge when it comes to being able to overcome the expenses that you need to incur in terms of inviting a trained professional vet to your farm to actually vaccinate all the birds that you have. But the catch is, the vaccination is not always charged expensively. And you can hear my dog agrees with me, by the way. The vaccination is not normally charged quite expensively. Normally they charge about 2 to 3 shillings per bird on the vaccination, if you're in Kenya, that is. I don't know how they charge in other countries, but 2 to 3 shillings per bird compared to the loss that you might incur if you do not vaccinate your birds would prove to be quite cost effective. Now that is what I wanted to talk about today. But here is the catch to this video. When it comes to turkey poults, like the one I'm holding in my hand, there are 2 diseases that may affect them that may be likened to fowlpox. The first one is fowlpox, the one that I've shown you. The other one is referred to as a blackhead disease. Now, I do not have a turkey at hand that is actually experiencing blackhead disease. But the challenge with blackhead disease is that it is almost impossible to treat. And the times that I've interacted with it, it has always led to almost 100% mortality in my turkey poults. The symptoms are normally the same. The swellings swell as you can see on the turkey poult, but the tips of the swellings normally turn black. That is as far as I can describe them as per my experience. The second one, they normally have yellow droppings or yellow diarrhea. Now, most of the turkeys or the chicks that you experience, you will realize that when there is brown diarrhea, you can liken it to maybe uh, infections like, what is it called? The infections that normally depict themselves in brown droppings in chicken, maybe gumboro or any other infection. But when it comes to turkeys, the moment you identify yellow droppings or yellow diarrhea on your turkey, I am almost 100% sure that is blackhead disease. Challenges, so far as I have tried researching, there is no vaccination for blackhead disease. There is no treatment for blackhead disease. You may just try to manage it by providing the broad spectrum antibiotic, as I had mentioned earlier, but the success rate may prove to be very low. How do you overcome blackhead disease though? One, do not mix your turkeys with your chicken. I know people want to diversify by putting all these birds together to manage on your space and to overcome any other challenges that you may have in terms of spacing your birds, but I have come to realize that when you mix your turkeys with your chicken, then such cases occur as fowl pox and blackhead disease. Two, the management process for turkeys may be similar to the chicken, but not all the turkey diseases are actually able to be vaccinated locally with it from our local agrovets or through our local vets. So it is quite challenging when you get to experience such a disease, but I only hope that over time, as many people get to actually start keeping more turkeys and more and diversifying into these other breeds of birds instead of only sticking to poultry, I hope our veterinary officers and the Kenya Veterinary Board would be able to consider these are the challenges that the farmers that do not actually only rear chicken may be facing. I look forward to a time when it will be possible to get a treatment for blackhead disease and any other viruses that are not curable at the moment out there. And I only hope that through our interactive sessions, we may be able to find farmers that may have experienced the same challenges and may have had different means of managing that may have proved to be successful. That is it for me today, and I only hope that my turkey poult here is going to survive this as I try to medicate him. Thank you and see you next Saturday.